came in March to have some work done, and the question the young lady asked me was, is it safe to inject again after 6 months? In fact, in my practice, I plan almost like a patient journey. So, and I like also not to do things all in one sitting, okay? Because you want a very natural progression, okay? So I would see my patients, like example, we saw this lady just now, and I would see her maybe in 4 to 6 weeks' time to see how the actual product has integrated with the tissues, because it varies from one person to another. And if you've injected 6, 7, 10, 12 syringes in one, you don't know how it's going to respond. So I will inject maybe 2, maybe 4 syringes in one sitting, that's it. I'll bring the patient back after 4 to 6 weeks, and then we'll see if she needs anything else, or we work on another area, or we augment a little bit the areas we've already treated. I think it's very difficult sometimes that when you over-inject in one area, then after a few weeks it tends to go too much. You have no control over this. Sorry, go on.
هي عملت لها انجكشن زميلته دكتور غنيمة العمر من الكويت. سألته إذا عادي إذا بترجع بعد 6 أشهر تعمل انجكشن. بيقول ايه اكيد. هي لكل بيشنت بتجي لعنده بيعمل لها مثل جدول انه هيدا الشهر بعمل لها هالبارت من وجهها، ثاني مرة هالبارت من وجهها، إلا إنه ما بيعرف كيف البرودكت حيتعامل مع جلدها وحينتشر مع جلدها.
So sit forward. There was a lady earlier who was asking about the jawline. Okay, I'm just going to mark with a pencil. The cannulas are just here, aren't they? They're all 27? Yeah. 27. Have you got that pencil?
Yes. Just 1 second.
Good. So what's really important when we're injecting the jawline, depending on what kind of couch, etc. you have, sit nice and upright, nice and forward. Okay, that's beautiful. Thank you. Okay, is to actually mark the jawline itself, okay, because that's really important, because when she lies back it's going to change, all right? So you have to mark your line very specifically so that we can actually inject her along the jawline. Okay, that's it, that's beautiful.
Is this a special marker?
No,
Just like...
yeah, just a regular it's my eyeliner actually. So there we go. No, I don't think it's a special marker. You can get surgical markers as well, but the thing with that, it's so difficult to wipe them off with the alcohol and everything and all this. So, okay, so you can feel, once again, that this is actually her jawline. Do you want to feel? Someone have a feel? That's her jawline. That we're not cheating? Yes. Yes, that's what we want to do. Yes? We don't want to give her volume here, right? We want to just define this. Good. So we're just going to cleanse our entry point. Okay, and I'm going to do this with Restylane Define. As I said, for the male I used the Restylane Perlane or Lift. If she was an older lady and we wanted to really create a nicer definition of her jawline, we would maybe use the Lift as well. She has soft skin, she's a youthful patient, we want a soft, gentle result for her. Okay? So that's away. Excellent. So, good, this is Restylane Define. Okay, so I'm just going to place, that's it. This is going to go immediate in the hypodermis or the subcutaneous layer. This is not going to be deep. Okay, you remember what we did there? We used this in the subcutaneous layer. Okay. I've been told that this is a 24 gauge needle and this is a 25 gauge cannula. So I hope we'll be able to get it in. Yep, go. That's it. Excellent. Sorry? The jaw angle of the jaw is just here, just a few millimeters just below. Okay, so I just want to enter. Here we go, just here, because when we mark this, it's actually just slightly there. This is where I'm going to be. There, see, here. Okay, just a fraction above that line. Okay, here's her jawline and face, and to create a nice sharp line there, will the gonal point, just there, the angle of her mandible is just sitting there. Okay, so if you sit back for me, exactly the same principles. Thank you. We'll just clean this. Just turn away from me, my dear. Okay, excellent. Cleanse the area that we're going to enter. I'm using a. No. Okay, good. So this is my gonal point, just here. I'm going to pinch the skin because we want to make sure we're clear of any vessels or anything like this.
Over the angle?
Yeah, just in front of the angle. So you can imagine if the angle is like this, just literally here. Okay, literally millimeters above it. Okay, good. Good. Okay, that's fine. That's fantastic. Thank you. Okay, good. So we just stretch the skin now. And without any light or anything, we're going to try and enter this hole. Beautiful. Okay, you may feel a little discomfort. You know this from the cannula. Patients are aware of this. I'm going to go just, if you remember, even like last time, it was just above the line that I drew there. Okay, and that's it. It's sitting just there. Okay, the tip of my cannula is just here, just where a little mole is there. Okay, that's the tip of my cannula, and we're just going to inject. Sorry? Retrograde injection technique, absolutely correct. Yeah, you can imagine when she smiles. See, look how she smiles. When she smiles here, look what happens this side. It's almost like those emojis. You have a sad face and a happy face. Her right-hand side looks happy. This looks sad. Because of the way we've changed the way the light hits this part of the face, we've changed the OG curve. That's all. Okay? One injection point. That's all I did. Because she didn't need too much lifting or volume, just a little bit. Okay? So, smile again. Relax. So I'm just going to go here. Okay, that's fine. So once again, I'm now on the bone. Okay? Yes, zygomatic. Absolutely correct. Okay? And we're just going to place more curve. Correct. Absolutely correct. Good. So I'm just going to. Are you okay? Nice slow injection. All I've done is 0.1, that's all you see at the moment. And you can see already how it's starting to lift. But the point is how slowly you actually inject. That way the patient doesn't feel discomfort. There's no need to use maybe ice or local anesthetic cream or anything like this because the speed of injection really makes a big difference.
It's safe.
There's nothing safe on the face, to be honest. If you look at the vasculature, I'm going to inject 0.3. Okay. But once again, that will vary from patient to patient, depending on what it is we're trying to do. She has a little bit of heavy. Okay. Good. Yes, define. Yeah, no, I'm just cleaning the black mark off. I just don't like any of this. Okay. Good. So you can see very clearly the difference between the right-hand side and the left-hand side, but very soft, very delicate, because we don't want to over-inject this lady. Can I come this way? Thank you.